Welcome to Guideline Central. My name is Dr. Tabitha Michaud, and today we'll be discussing the APA's guideline titled the American Psychiatric Association's Practice Guideline for the Treatment of Patients with Schizophrenia. Now, this guideline was originally released in September of 2020 and can be found on the APA's website, which there's a full text link to on our website at guidelinescentral.com. Now, the goal of this guideline is to improve the treatment outcomes and quality of care for patients with schizophrenia by enhancing the treatment for affected individuals, therefore reducing the morbidity, mortality, and the significant health and psychosocial consequences of having this condition. For this guideline, the APA has used the grade approach and determined their final ratings for their statements using the guideline development process endorsed by the APA's Board of Trustees. That means for each statement from the APA, there will be a confidence grading of either 1 or 2, with recommendations being a grading 1 and suggestion statements being a grading 2. Each statement will also have a rating for the strength of the supporting research evidence, and that will be either a high, moderate, or low quality of evidence, and that's reflected by an A, B, or C denotation in the full text guideline. And with that, we have 24 statements from the APA on the treatment of patients with schizophrenia, but do note that none of these statements are meant to stand alone. So with that, let's get into the guidelines. Now, the guideline statements in this guideline were divided into 3 sections, with the first section's statements all being related to the assessment and determination of treatment plan. Now, these guidelines do include tables that have detailed recommendations for suggested physical and laboratory assessments, and you can find those in both the pocket guide and full text guideline available on our website at guidelinescentral.com. Now, our first guideline statement from the APA is a recommendation with a low strength of supporting research evidence, and that's for the recommendation that the initial assessment for a patient presenting with a possible psychotic disorder should include the reason that the individual is presenting for evaluation, the patient's goals and preferences for treatment, a review of psychiatric symptoms and trauma history, an assessment of tobacco use and other substance use, a psychiatric treatment history, an assessment of physical health, an assessment of psychosocial and cultural factors, a mental status exam, including a cognitive assessment, and an assessment of the risk of suicide and aggressive behaviors, as outlined in the APA's practice guidelines for the psychiatric evaluation of adults. Our second guideline statement from the APA includes the recommendation with a low strength of supporting research evidence that patients presenting for a possible psychotic disorder during their initial evaluation should be given a quantitative measurement evaluation to help determine the severity of their symptoms and the impairment in function that might be a focus for their treatment. Our third guideline statement from the APA is a recommendation with a low strength of supporting research evidence, and that's for the recommendation that for patients with schizophrenia, they should have a documented, comprehensive, and person-centered treatment plan that includes evidence-based pharmacological and non-pharmacological treatments. Now, our next few statements from the APA fall under the section titled Pharmacotherapy, but do note that these statements should all be taken in a person-centered treatment plan approach that includes evidence-based pharmacological and non-pharmacological therapies. Now, before we get into the pharmacotherapy statements, I just want to mention that in both the full text and the pocket guides, you can find tables that include the available antipsychotic treatments, as well as information about implementation considerations, dosing, and side effects for these medications. You can find that on our website. Our fourth guideline statement, the first in our pharmacotherapy section, is a recommendation from the APA with a high strength of supporting research evidence, and that's for the recommendation that patients with schizophrenia should be treated with an antipsychotic medication and monitored for both the effectiveness and possible side effects. The choice of medication for your patient should take into consideration things like addressing the patient's non- or partial response to medications, the side effect profile, the presence of other health conditions that may be affected by medication side effects, available formulations, drug interactions and metabolism, and the medication's pharmacokinetic properties, just to name a few. Our fifth guideline statement from the APA is a recommendation with a high strength of supporting research evidence, and that's for the recommendation that for patients with schizophrenia whose symptoms improved with antipsychotic treatment, they should be continued on treatment with an antipsychotic medication. Guideline statement number 6 from the APA is a suggestion statement, and that's for the suggestion that for patients with schizophrenia whose symptoms improved with an antipsychotic treatment should be continued on the same antipsychotic medication. Guideline statement number 7 from the APA is a recommendation that for patients with treatment-resistant schizophrenia, they should be treated with clozapine. This was given a moderate strength of supporting evidence. The 8th guideline statement from the APA is a recommendation with moderate strength of supporting evidence, and that's the recommendation that patients with schizophrenia be treated with clozapine if the risk for suicide attempts or suicide is substantial despite other treatments. Next up, the APA suggests that patients with schizophrenia should be treated with clozapine if the risk for aggressive behavior remains substantial despite other treatments. This was given a low strength of supporting evidence. Guideline statement number 10 from the APA is a suggestion statement with a moderate strength of supporting research evidence, and that's for the suggestion that patients with schizophrenia be treated with a long-acting injectable antipsychotic medication if they prefer, or if there's a history of poor or uncertain adherence. Our next guideline statement from the APA is a recommendation with a low strength of supporting research evidence, and that's the recommendation that for patients who develop acute dystonia associated with antipsychotic therapy, they should be treated with an anticholinergic medication. For guideline statement number 12, the APA makes the following suggestions for patients who develop Parkinsonism associated with antipsychotic therapy. They suggest lowering the dosage of the antipsychotic medication, switching to another antipsychotic medication, or treating with an anticholinergic medication. Our next guideline statement from the APA is another suggestion statement with a low strength of supporting research evidence, and here they make the following suggestions for patients who develop akathisia associated with antipsychotic therapy. Here they suggest lowering the dosage of the antipsychotic medication, switching to another antipsychotic medication, adding a benzodiazepine medication, or adding a beta-adrenergic blocking agent. Guideline statement number 14 from the APA is a recommendation with a moderate strength of supporting research evidence, and here the APA recommends for patients who develop moderate to severe or disabling tardive dyskinesia as a side effect of antipsychotic therapy, they should be treated with a reversible VMAT2 inhibitor. Now our final set of guideline statements all fall under the section titled Psychosocial Interventions, but these statements again should be implemented in a person-centered treatment plan and should include evidence-based pharmacological and non-pharmacological therapies. Guideline statement number 15 is our first of the psychosocial intervention statements, and here the APA recommends, with a moderate strength of supporting research evidence, that for patients with schizophrenia experiencing their first episode of psychosis, they should be treated in a coordinated specialty care program. Guideline statement number 16 from the APA recommends, with a moderate strength of supporting research evidence, that patients with schizophrenia be treated with cognitive behavioral therapy. Guideline statement number 17 from the APA recommends, with a moderate strength of supporting research evidence, that patients with schizophrenia receive psychoeducation. Our next psychosocial intervention guideline statement from the APA is a recommendation statement with a moderate strength of supporting research evidence. And here the APA recommends that patients with schizophrenia receive supported employment services. Guideline statement number 19 from the APA recommends, with a moderate strength of supporting research evidence, that patients with schizophrenia receive assertive community treatment if there's a history of poor engagement with services to try and prevent frequent relapse or social disruption. Our 20th guideline statement from the APA is a suggestion statement, and here they suggest, with a moderate strength of supporting research evidence, that patients with schizophrenia who have ongoing contact with their family receive family interventions. Our next guideline statement from the APA is a suggestion statement, and here they suggest, with a moderate strength of supporting research evidence, that patients with schizophrenia receive interventions aimed at developing their self-management skills and enhancing person-oriented recovery. Guideline statement number 22 from the APA is a suggestion statement, and here the APA suggests that patients with schizophrenia receive cognitive remediation. Our second to last guideline statement is a suggestion statement, and here the APA suggests, with a low strength of supporting research evidence, that patients with schizophrenia who have a therapeutic goal of enhancing their social function should receive social skills training. And our last guideline statement, number 24 from the APA, is a suggestion statement with a low strength of supporting research evidence. And here, the APA suggests that patients with schizophrenia receive supportive psychotherapy. And that wraps up the 24 guideline statements from the APA on the treatment of patients with schizophrenia. Now, this, of course, was our bird's eye view approach to the guideline in our Guideline Central quick reference format. So if you're looking for more information about these statements, including supporting research evidence and implementation considerations for your individual patient and their preferences, you can find the link to the full text guideline on our website at guidelinecentral.com. While you're there, make sure to check out our freely available provider and patient pocket guides for the treatment of patients with schizophrenia. Our patient guides are great educational resources to support patients going through treatment and are also ideal for the family and friends involved in their care. Thank you everyone for joining me today to talk about the APA's treatment of patients with schizophrenia guidelines. Make sure to check out our library of guideline quick reference content for hundreds of clinical practice guidelines from over 45 different medical societies. And we'll see you guys on the next guideline.